Good morning and welcome to today's 3C Participatory Action Research session. My name is Joe and I'll be your producer. A few quick housekeeping items before we begin the second day of today's BH-HIV conference. First, this event is being recorded and audio is now broadcasting. The views, opinions, and content expressed in this presentation and discussion do not necessarily reflect the views, opinions, or policies of the Center for Mental Health Services, CMHS, the Center for Substance Abuse Treatment, CSAP, the Substance Abuse and Mental Health Services Administration, SAMHSA, or the U.S. Department of Health and Human Services, HHS. We also have some live captioning available today, as we have throughout the conference. So if you click the link up at the top of your screen here, it'll open up a browser window which you can position anywhere you'd like on your screen and adjust the size, color, and speed of those captions. If you haven't attended any of the other sessions, you'll note that in the All Questions box in the lower left corner of your screen, you can click on that link as well. So if you lose your captions at any point in time, you'll be able to get them back by scrolling up to the top of the All Questions box. And if for some reason you can't find it, just drop us a note in that box and we will happily help you. Your lines will be muted during the presentation today, but there are a couple of ways that you can communicate with us. We have the public grantee chat, which I see is very active this morning. And I need to let you know that the comments in the chat box do not necessarily reflect the views or policies of the presenters, CMHS, CSAP, SAMHSA, or HHS. Everything that you type in that chat can be seen by everyone else in the room, so please be mindful of your colleagues. It is a great place to network, to share resources, to have side conversations. There will be some chat exercises, at least one today that Amanda intends to use. So please note where that chat box is and don't be shy. We also have the conference back channel. So if you use Twitter, you can use the hashtag BHHIVConf18 to follow the conversation, join the conversation, network with your fellow grantees. You can see highlights from the other sessions that you're not currently attending. And if you don't use Twitter or you don't want to try to keep up with the conversation while this is live, please write down that hashtag somewhere, because you will want to save that for your marketing department or your social media gurus. Later, there's going to be lots of great retweetable stuff that you'll be able to use, and lots of session highlights you'll want to go back and see. So if you're not following it now, it's fine, but please write that down because it will be useful to you later. And for questions today, we'll be using the All Questions box, which I mentioned already in the lower left corner of your screen. Any tech or content questions are going to go into that All Questions box. And just to make sure that everyone sees that before we move on, at the top of your screen, there's a person with their hand raised at the toolbar. If you click the drop-down menu, you'll be able to see that green check mark, just like the one on the screen. Would you please, if you can see the All Questions box and you know to put both tech and content questions in that box, give me a green check mark by using that status icon. I see a few people have already done it. I like to wait till we've got at least 51%, and we've got way more than that. Excellent. Thank you all. So we're going to move on, but if you have any questions, please let us know in the public chat. We'll point you to that All Questions box. And now I would like to introduce today's moderator, Ed Kraft. Ed?
Good morning, everybody. Welcome to day 2 of the meeting and the evaluation track. I'd like to introduce our next speakers for the Participatory Action Research session. This is Amanda Aykanian and Dr. Dixie King. They will be speaking to us today, again, on participatory action research. Ms. Aykanian has worked across several federally funded projects, such as for the Advocates for Human Potential Center for Research and Evaluation. She has worked in program evaluation for more than 10 years, with experience engaging key stakeholders, including program participants in evaluation design and implementation. You can read more about her in the bio sketch document. Our second speaker will be Dr. Dixie King, who many of you heard speak yesterday. But just to give you a little brief reminder of Dr. King's background, She's played a central role in developing the TCE HIV grantee meeting evaluation track for the past 2 years. She is the founder and president of Transforming Local Communities in Bakersfield, California. It's been my good fortune to have worked directly with Dr. King and to witness the comprehensive impact of her evaluation expertise. You can read more about her in the BioSketch document. Amanda?
Thank you, Ed and Joe, for getting us started. I am going to be on webcam today so folks can see me. If you see me look down, that's really just me looking at notes and looking at the chat that folks are participating in, so I can keep an eye on questions and things like that. Ed gave a great little overview of who I am, and I'll start with a little sort of overview of what I hope to accomplish today. So this presentation I've really designed to be an overview of participatory action research, kind of a primer for folks who are interested, and a starting point for people who might be interested in learning more and further exploring some of the ideas and methodological approach that we talk about today. So generally the goals for today's presentation are to talk about kind of the key concepts and methodologies that underlie participatory action research, or PAR. I'm going to define PAR and some of its guiding principles or guiding rules for implementing it. We'll talk about some basic considerations for when PAR is appropriate and less appropriate. We're going to go through some examples, both from myself and from Dixie, and then we'll talk about some of the pros and cons to using PAR, and as well as some basic suggestions for people who might be interested in further learning about this methodological approach, or exploring whether it's appropriate for your organization, for your program, or for your evaluation. We're going to start with a polling question to get some information from you all. So this first poll, I'm going to ask Joe to bring up. So this question is really asking just sort of where you are with familiarity with participatory action research. So if you can enter your answer there, that would be great. So it looks like so far a lot of people are sort of either having never heard of it or heard of it but don't know much about it, maybe somewhat familiar, less people with lots of knowledge, which is good for this session. Yeah, so it looks like just about a third of people are familiar but haven't really participated in the project, or heard of it but haven't really done anything with it, or don't know much about it. So that's great for today's session, because this, like I said, will be very introductory and sort of foundational for folks. So you can close that poll, Joe. Thank you. Okay, so I want to start with kind of a visual presentation of what we're going to talk about today. So this is really kind of just depicts some of the key concepts that underlie participatory action research, being participation, research, and action. And I'm going to unpack these boxes as we go on to throughout today's presentation, as well as talking about the specific methodological approaches that are listed in the middle. And of course, we'll talk about participatory action research, which is at the bottom, but I'm also going to start by talking about participatory research and action research as two kind of precursors to PAR. So like I said, I'll talk about each of these boxes specifically as we go through. So I present this really as a visual for you all to keep in your head to reflect on as we continue today. So before I go on, I'd like to acknowledge that the definitions and the concepts and the methodologies that I'm going to talk about today are debatable, they are debated, and they are evolving. This presentation is really intentionally very broad in interpretation and really presents participatory action research from a social work perspective, as well as the perspective of sort of practice and helping professions. But there are a lot of ways of thinking about participation and participatory action research, and anyone who sort of delves deeper into these topics after today's session will learn quite immediately that there are a lot of different ways of defining and talking about these ideas, and that really distinguishes itself across authors as well as across professions and disciplines. So I'd like to start by just saying, I acknowledge that there are lots of ways of looking at this, and I'm presenting sort of one perspective that comes primarily out of a sort of social work background, and really the background through which I learned about participatory action research from mentors of my own. Okay, so I want to talk with, start talking in today's presentation about participation, because this is really the sort of undergirding factor in PAR and participatory research in general. And I want to sort of take a little time to unpack what we mean by participation and ways to think about participation. So broadly defined, participation really just means that you're engaging stakeholders in the planning, implementation, or evaluation of a project, of a process, or of a larger activity. And while I'm really going to talk about participation today in the context of research, it's not a research-specific idea. It's really one that was developed outside of the research world and then sort of infused and adopted into the research world. And when we think about participation in the context of program evaluation, it can be useful both for pursuing process-oriented goals and impact-oriented goals. So understanding what is happening and understanding how it's happening. And part of what happens when you talk about something like participation with a broad definition is it gets a little hard to kind of concretely think about it in the context of a project. And so one way to move from that broad definition to more concrete conceptualizations of participation is through typologies for describing or categorizing participation. And there are a lot of these typologies. People have written quite a bit about participation, and I'm going to present just two today that I think are useful both for an introductory session, but also just for thinking about participation in the context of program evaluation or other research. So this first one is Ensigns Ladder of citizen participation. So this visual isn't exactly presented as a ladder, it's sort of stacked blocks, but the idea is that it's a ladder with lower, middle, and upper rungs. And Einstein basically uses this to illustrate degrees of participation that progress from lower rungs of a ladder that represent non-participation. So these are the sort of maroon and red rungs, boxes, to middle rungs that represent what Einstein would describe as tokenistic or tokenism participation. So that would be the orange toned rungs in the middle. To then upper rungs that represent high degrees of participation, of shared power, and even citizen control. And as you look at this ladder, you might consider how service models map onto it. So for example, traditional service models where providers are viewed as knowing what's best for clients would fit on these lower rungs of non-participation or little participation. Then the use of consumer advisory boards, for example, to inform service design would fit towards the middle rungs. And then forms of peer support and peer-delivered services would fit up towards the green boxes, not necessarily at the top, but certainly around the partnership and delegated power boxes, depending on how they are implemented. So another way to think about this, moving from degree of participation, is to think about who participates and how they participate. So this slide presents another typology, specifically looking at these factors. So instead of thinking about whether the power is shared or if it's partial, you can think about who is doing the participating. So narrow participation would be having only some or selected stakeholders participate. So this might mean having your frontline staff, for example, participate in developing a data collection tool. Wide participation, on the other hand, would be having a wide range or even all key stakeholders participate in that process. So for example, you might have your program directors, your frontline staff, your service users and former service users, your community partners and local policymakers participate in a process of developing a data collection tool. You can also think about how those stakeholders are participating. And you can think about this on a continuum of going from shallow to deep. So shallow participation would be having stakeholders participate in just one or some aspect of a project. So having those stakeholders I just described only participate in developing your data collection tool. On the other hand, a deep participation would be having stakeholders participate in many or all aspects of your project. So having those stakeholders involved in question formation, research question, and problem identification processes, all the way through to the dissemination of your findings or results. So I encourage you to think about, to keep these things in mind as we go today, the ladder of participation, this narrow and wide participation, or shallow versus deep participation, to think about what would be possible in your project, what's currently happening in your project, and what sounds sort of interesting or doable or appropriate given your own context. I'm going to move on to the next poll. So Joe, if you can bring this up for me. So thinking about what we just talked about in terms of describing participation, thinking about how you engage service users in activities, how would you describe the level of participation of service users in your organization's planning, implementation, or evaluation activities? I'll give folks a few seconds to fill that out. So it looks like about half of folks are saying that service users participate in very few activities. A little more than a third say that service users participate in several activities. And about 10% or so say service users participate in most or all activities. And then a couple folks saying that service users don't participate in any activities. And I would say that's probably representative of what most agencies I've worked with or programs I've worked with probably fall in a similar scenario as the folks on this call. So again, a good indicator of who's on this call and a good indicator of what's appropriate, the appropriate sort of introductory perspective of this presentation. All right, so you can close that poll for me. So now I want to talk a little bit about participatory research, and we'll talk about action research as well before going into PAR, just because I think it's good to get a sense of where we are starting from, but also because sometimes it makes the most sense to start with a participatory research approach or an action research approach before kind of diving into PAR as a methodological strategy. So participatory research is research that engages beneficiaries, users, or stakeholders of the research in some or all aspects of the research. It combines the researcher's expertise and the lived experience of local stakeholders, which strengthens the study by adding a combination of practical knowledge along with sort of empirical and academic knowledge, all within the sort of knowledge and background of a real-world context. The collaboration between researchers and stakeholders also creates a nice shared learning experience, so researchers can learn from the stakeholders, and stakeholders can learn from the researcher and the research experience. And participatory research is really an umbrella term. So it can encompass many forms of research, many methodological approaches. It's really a broad strategy for describing any research approach that engages stakeholders in a participatory way. Now, the sort of other piece of PAR is this action idea. And action in this context really refers to the process of implementing a change, making a decision, all in a real-world context and based on available information. And rather than go into depth on what action means on its own, I want to talk about it specifically in the context of research. So when we talk about action research, it's an approach to research or evaluation that focuses on generating what we call actionable knowledge. So in other words, knowledge that specifically informs acting, change, or decisions that can be immediately implemented. So unlike traditional research that often is developing knowledge for knowledge's sake or developing information to contribute to a body of knowledge, Action research is explicitly concerned with developing information or knowledge that can be used for action. Action research occurs in cycles of studying and acting, so it's an iterative process. Action research can test both empirical and theoretical knowledge, as well as practical and lived experience, knowledge driven from practice and lived experience. It's an approach that is typically collaborative, so done in teams, and it's often participatory, though not always. And action research, because it's action-oriented and because it's iterative and cyclical, fits within traditional problem-solving approaches. So if you're familiar with the health model, health improvement model of plan, do, study, act, action research fits very well in that kind of improvement approach or continuous quality improvement strategies similar to it. So now, if we think about everything we've talked about so far, and specifically taking this participatory research approach and the action research approach and combining them, we start to get to what we call participatory action research. And this is really an interesting and kind of engaging approach to research. So PAR is research with the goal of action. So the goal is to seek information to inform immediate change or decision making. Like action research, it occurs in successive or iterative cycles. So a PAR study is not a one-off activity. It is an ongoing iterative process. PAR values the lived experience, knowledge, and opinions of local stakeholders. And it is participatory, but it is decidedly democratic about participation. So it situates itself at those higher rungs of Ensigns Ladder, where power is shared and balanced among what PAR often refers to as co-researchers, or that come from key stakeholder groups. And those co-researchers often include people who are traditionally marginalized, oppressed, or voiceless, and often include service users or potential service users. PAR occurs in real-world context, so it's very specific to a particular program, organization, or community. And because of that, unlike traditional research where the goal is to generate findings that are generalizable, the goal in PAR is that the process is generalizable. So you may use PAR in your health clinic to address a problem or phenomenon and develop a solution and a series of solutions and actions to address that problem. But the goal there is not that your solutions should then be adapted by other health clinics. The goal instead is that the process through which you came to those solutions and implemented those solutions and evaluated those solutions is an adaptable process. That's a distinction between PAR and sort of a traditional research approach. And then finally, PAR is an approach to research that views traditional research as potentially harmful, oppressive, or marginalizing to those who are typically subjects of research. And so it tries to counter that through democratic participation, shared learning, and empowerment. So of course, PAR, like any research method approach, is really not going to be appropriate in all scenarios. There are some basic ideas of when PAR is sort of best suited or appropriate. PAR is really best suited to problems that are complex, or what many people call wicked problems, and problems that are complex because they are new, because they are multidimensional or multifaceted, or simply because they're not well understood. Thus, PAR is also useful when no easy answer exists to a problem. So in other words, if there is already a well-established body of literature, if there are already effective and evidence-based solutions to problems, PAR is likely not going to be the best bet in that situation, at least initially. However, if those evidence-informed interventions or best practices are unsuccessful in your program context, and you're unsure why that's the case, then PAR may be useful in exploring that problem and coming up with solutions to that problem. because participation or participatory action research is participatory, it's especially appropriate when solving a problem means that you need information and knowledge from local stakeholders. So when you as a researcher don't possess enough information, or even as a program administrator don't possess enough information, then you need information from local stakeholders. And then finally, I would say that PAR is best suited to situations when solving a problem is likely to require an iterative process, a cyclical process, or a process of trial and error. And that goes hand in hand really with the idea that PAR is most appropriate when a problem is complex and no easy solutions exist. So I'm going to present some what I call rules here and what others have called rules. Partly because PAR, as interesting and sort of innovative as it sounds, it can sound, look, and even feel somewhat unstructured and certainly nonlinear when you're comparing it to more traditional research approaches. And but like any other research approach, it does have some basic guiding principles and rules that are important to keep in mind. And I don't have time to cover all of these rules, and frankly, there are probably countless rules depending on who you were to ask. But the Lawson book that I've cited on this slide and that is included in the references slide at the end of this presentation goes into good depth on this topic. And so instead, I'm going to highlight just a few rules here. And the ones I've chosen specifically because they either align with or diverge from traditional research rules. So to start, even though PAR is done in a real-world context, it's still really important to look at basic academic knowledge, scholarly research that's been done, in addition to local knowledge and the information and expertise that you can gain from your local stakeholders and local experts. Also, like other research or evaluation endeavors, you want to consider whether an IRB review is appropriate, and in cases when that is needed, you may need to work closely with your IRB to ensure that they both understand participatory action research and that they are aware of some of the processes and expectations around it, so that you can develop an approach that is appropriate both for their demands as an IRB, but also doesn't hinder too much the actual PAR approach, especially when engaging service users or potential service users. You also want to be really intentional about the stakeholders that you engage. You want to think about, what groups you want involved, how many, whose voices are needed, and be open to the fact that this can really change, especially because PAR is cyclical. So you may need to add stakeholders, remove stakeholders, or change stakeholders from cycle, as you progress through cycles of PAR. And anytime you engage stakeholders in PAR, they need training and support. And they need training both on what participatory action research is, as well as what research tasks they may be participating in. And that training needs to be ongoing, and they need to be supported through the whole process. Because you're engaging stakeholders from different groups who may not have any relationship with each other or may not be used to working with each other, as a researcher, your role also requires an element of managing group dynamics, helping the group establish group norms, and being prepared to deal with potential conflict and disagreements and things like that. And how you do this, how you manage this whole process, needs to be guided by the general prioritization of wanting to facilitate group consensus, wanting to ensure voice and choice for your stakeholders, and wanting to have a shared power dynamic, so a non-hierarchical power dynamic. And part of what can help that is sort of taking on this facilitative role or understanding your role as a researcher as a facilitator. And then you also want to remind your stakeholders that the focus throughout a PAR study is on actionable solutions. So decisions around data collection, data analysis, and dissemination need to be made within that vein of how is information actionable and made actionable. And part of what can facilitate that is taking really good notes, keeping good records of ideas that have been generated. So one of the things that can be challenging with PAR is that it can be a slow process and it can be incremental. So you want to really acknowledge that, embrace that, celebrate small accomplishments, consider the need to make adjustments to who is participating, what they're doing. You may also want to consider whether subgroups or task forces are appropriate to tackle different parts of a project, either because there's a lot of work or because certain people have interests in doing certain tasks versus others. And finally, because PAR is a participatory approach that views participation as democratic, so you have these equally powered co-researchers, all decisions around publishing and dissemination need to be done with that in mind. So whether it's writing a research article or presenting at a conference, that you need to be democratic about making decisions about who presents, who gets the credit, and sort of how you decide how to disseminate those things. Okay, so we're going to pause the content here and talk a little bit about some examples of PAR. And so I'd like to bring Dixie on camera if she doesn't mind. And I'm going to let Dixie start actually just because you all have been listening to me for a while. So Dixie, would you mind sharing some examples before we do the sort of pros and cons and suggestions?
Sure, I'm happy to do that. And people are probably very relieved to be hearing you today, Amanda, because they got to hear me all day yesterday. So anyway, welcome back, everyone. And yeah, I've got two examples I'd like to share. One came from something called the Mental Health Services Act here in California, which is a proposition that was passed way back in, I think it was 2004, in which folks with a net income of over $1 million are taxed 1% that goes toward mental health services in the state. And so every county was required after the passage of that bill to submit a plan of action that was based on needs assessment. And they wanted as much involvement of stakeholders as possible. So we were invited in to do the needs assessment in Kern County. And what we were able to do was to actually hire folks from the mental health system of care. So we put out applications, we put out information, and we actually had a person from behavioral health who was a case manager who came on board with us to help manage, because we knew that some people were very medication dependent and might have some issues or concerns. And we were able to hire 15 people who actually included, one person was from NAMI, the National Alliance on Mental Illness, and the rest were consumers. And we also had 5 social worker students from Cal State Bakersfield who joined us on board. So we had this plus my own team, so we had this very eclectic group of folks. And what we did is we started by training everyone, and we put everybody into a whole series of trainings, but we started with diversity. And we started with diversity because of the importance of understanding the differences in background that people were coming from and experience that people were coming from. And it was really interesting that after a day of very interactive activities in which people were kind of laying their souls bare with each other by the end of the day, we had our social work students indicating how nervous they were to be there simply because they were afraid that because they were students in the field that the expectation would be much higher for them and they didn't know what they were doing. We had folks from the consumer group who were sharing that they were really worried that they wouldn't have the capacity to do the work, and they were worried about their medications. They were worried. A lot of these folks had co-occurring disorders, and some of them were very new to sobriety, and so there was just a lot of fear around, am I going to be able to perform, and will this be okay? Because there's been a whole, and you have to consider this when you're bringing people on board. There had been a whole history of failures in their eyes from being part of the community and trying to work and trying to integrate into what we call a normative environment here. So my own team admitted that they were really worried because they had no idea how to work with all these different populations. So everybody was just very honest and open with each other by the end of the day. And out of that, we ended up designing a whole training program based on the needs that people expressed. But one of the concerns we did have to take into consideration is that back in that day, it's changed a little bit since then, if our consumers earned a certain amount of money, they would end up losing their medical benefits. And losing their medical benefits meant that they would be losing access to their medications. And so we had to be extremely cautious about how many hours we used people. And we actually hired people on a temporary basis, obviously, but they worked with us for over 6 months. During that time, we lost 2 people from the program, both because they went back out and started using. And the level of capacity really varied among our participants. We had a couple of people who were very highly compromised, and they could not interact well with others, but they hung in, and we were able to find plenty of tasks that they could do and feel very excited about. But what we really used folks for, and I say used, it sounds like we're exploiting them, but what we involved them in, and we gave them lots and lots of options, is the development of our instruments. And they helped us with survey development, they helped us with focus group protocol development, and they also helped us with key informant interview protocols. And then they went out and they piloted all of that with us, and then we came back and we cleaned everything up based on what we learned, and then we sent them out to actually do the work. And our belief was that because a large portion of what we were doing was with the consumer community, we believed that if we really went out and allowed our consumers to meet with other consumers to talk, they would get much better information than we would get. And that, in fact, turned out to be the case. So not only were these people able to get paid for their participation, which I think is really important because we don't want to exploit groups, we also, they were recognized by our County Board of Supervisors and given an award for the amazing work that they did, and it truly was amazing. We were one of the first counties in the state to get funded based on the research that they did. And so that was just an example of how working together, and by the way, 3 of those folks, 3 of the consumers ended up getting full-time permanent jobs out of this because they just demonstrated such capacity. And in the evaluations that they completed at the end of the program, what we heard almost from everyone was how empowered they felt at a time in their lives when, because of the fact that they were consumers in the mental health system of care, they felt very disempowered. And they talked to us about the importance of being able to hold a job in a society that very much looks down upon and judges people who do not work. And so all of that was an education for us and for my staff, as well as just an amazing opportunity for collaboration. The other project that we've done more recently, and people heard me reference this in some of our earlier webinars, is with a group of young people in Kings County, California. It's a small county north of us that has about 153,000 people. And we started working 2.5 years ago with young people from all over the county that we recruited in to form a team that we called Be the Change You Want in Your Community. And this was, again, based on innovation funding from the Mental Health Services Act that the county chose to direct in this way. It was to work with transition age youth, 16 to 24. We had young people who came in from probation, from the mental health system of care, from schools that simply referred them. We had kids who were in the system of care, kids who were not, kids who were on probation, kids who were not. You would never have known which was which based on what you would see happening within our groups. We met with these kids for 4 to 6 hours at a time on Saturdays, and we gave them some very, very intensive training in data collection. They were out, they conducted door-to-door surveys throughout their county. They did intercept surveys, they did focus groups, they did key informant interviews. They put together an amazing documentary thanks to the help we received from a media arts instructor. And the data that they collected was really to find out how mental health was being addressed in their respective communities, what kind of stigma attached to it, what kind of resources were available, and how likely young people in that age group were to access services. And we found an amazing amount of information out that we provided back to the county, and based on that documentary and some public service announcements those youth have done, the county is now interested in moving forward to the next phase of implementation, and we just found this out yesterday, in which they're going to be using the model that we created in order to do a promotora program, basically a model of a promotora program where peer educators will be trained to go out and actually do outreach in these communities with a specific focus on stigma reduction. So it's just, participatory action research is something we believe so strongly in that we try now to incorporate it into almost every project we do. So thanks for letting me share.
Great. Yeah, thank you so much, Dixie. Those are great examples, and I love hearing about the work that you're doing. So I'll give a little example from my own work before continuing on in the presentation. And part of what I do as an evaluator and as a graduate student, a doctoral candidate outside of work, is I do a little bit of consulting on methodological approaches for evaluation and for research. And recently have started working with an agency doing an evaluation of a program for that provides outreach and case management services for youth experiencing homelessness. And they were really interested in being more participatory and sort of pursuing a participatory action research goal. And so I came on board as sort of a consultant and an advisor in what that process might look like. And one thing I sort of stress to them and stress often is that co-researchers in the context of a participatory action study doesn't necessarily mean that everyone does everything. You can have co-researchers who have that sort of shared balanced power, but that they choose to be involved in things that make sense for them, in things that are appealing to them, and things that they're very well suited for. And so we took that sort of message throughout the process of developing an approach to this evaluation. So we started really by first engaging stakeholders. We went through a whole process of kind of figuring out who we wanted involved and identifying and recruiting people. And once we had that, we had a couple work group sessions to develop the study design and the IRB application. And this was really interesting because it let people participate in really thinking through what was feasible for an evaluation study, what appropriate consent procedures should look like for participants, what recruitment might look like, strategies around identifying people and engaging people, developing data collection tools and really figuring out what data collection methods were most appropriate. And really, because people were engaged in that very early phase, they could really think about where stakeholders were could most appropriately be engaged throughout the process. So, for example, we ended up designing it so that program graduates, so people who had been in the program prior to the evaluation, were co-facilitating focus groups with current program participants. They were also participating, as Dixie described in her study, in developing the protocol for focus groups and for key informant interviews, because they have this lived experience that was really appropriate, but also offer the ability to kind of connect with participants in ways that the evaluators may not. And then thinking about other stakeholders that we had engaged, we had some community partners and staff of the program and some other sort of non-service providing stakeholders who were engaged in things like key informant interview development and stakeholder focus group facilitating, because they have an experience and a contextual background that we as the evaluators didn't necessarily have, which helps them write questions, but also would help them facilitate those interviews and be able to appropriately probe and really think about follow-up questions in ways that we may not. And they also had existing relationships with some of the stakeholders that the study was engaging. And so that sort of initial rapport facilitates a good interviewing and focus group development. And then we also developed ways to engage stakeholders in the analysis and interpretation and dissemination approaches, specifically around coding the qualitative data of focus groups and key informant interviews, which of course all of this involves training and real support from the evaluators. But having started from this point of having a work group around study design and IRB material development, it really gave the whole group this kind of from the beginning perspective of where do stakeholders participate, where are they most appropriate, who has an interest in doing what, where are people's skills and natural inclinations most aligned, and so how do we really consider these sort of co-researcher approach from step one, which has been a very successful way to design an evaluation, and as so far the evaluation is still going on, has been a successful way of conducting it. So I hope these examples are helpful, and I encourage folks to put questions in the public chat if you have them, or questions in the Q&A box for Dixie or myself. There are also more examples in the references slide. The books and articles that I cite there have more examples if you're interested in learning more. So I'm going to go on now and talk about some benefits, some challenges, and some basic suggestions for those of you who are interested in using PAR. So, of course, as any methodological approach, there are pros and cons. So one benefit of PAR is that it lets the researcher basically combine social analysis approaches with the social action, And what some social workers in the PAR movement have described this as moving from a researcher to a scholar change agent. So really combining these two roles. PAR also maximizes researcher expertise and participant experience, which in a way that doesn't prioritize one over the other. It really considers both very important. As I said earlier, it creates a shared learning experience for both researcher and stakeholders. So you learn from each other as well as learning from the process. And PAR is really unique in that it kind of combines research and practice. So it blends research and practice because it aligns with some of the intervention and group and community-based skills, practice skills that social workers and other helping professionals are very familiar with. And it itself is really a form of empowerment practice. And Dixie's example earlier highlights that, this idea that it can be a very empowering experience for people who are often marginalized, who are often voiceless, who in a PAR setting really are given a very different role within research that is traditionally done upon them. PAR also fits within quality improvement and problem-solving frameworks, as I said earlier. So if you are oriented to thinking about improving a program, this really fits with that. And it's compatible with a range of research methods, both traditional ones as well as methods both within qualitative, quantitative, and mixed methods approaches, and non-traditional ones, things like arts-based methods, photo voice, theater, or performative approaches. It's not tied to one particular methodological family. So of course, anything with pros also has cons. I think one of the biggest challenges with PAR is that it requires sort of a massive mental shift for a researcher as well as for the stakeholders engaged. It can feel somewhat unnatural, it can feel uncomfortable, especially if you've been trained in very traditional research approaches, so it can be uncomfortable for the researcher or evaluator in terms of sort of changing your own approach and your own role, as well as uncomfortable for stakeholders who maybe aren't used to having a shared or partnership relationship with an evaluator. PAR can be very time-consuming, and this is because it's cyclical, because there are different sort of training and logistics oriented to it. But really the benefits of PAR depend on the amount of work that you put into it. So that investment of more time is really how you get the best benefits and the best impact. Part of what makes it time-consuming is that there are some added logistics to a PAR study that aren't really the case with traditional research. So there's a lot of training that's involved. So like Dixie alluded to earlier, and myself in my own example, you're training participants or stakeholders throughout the process. You're also managing group dynamics, and that can be time-consuming. It also requires a researcher's role to shift a bit. and requires some new and different skills. So as a researcher or an evaluator, you're no longer this sort of all-knowing researcher. You're no longer the evaluation director leading the charge. You're now a co-researcher who really needs to be able to be open to new knowledge, who needs to be ready for collaboration with people who are not traditionally or formally trained researchers, and need to be prepared to take on a more facilitative role. Instead of being a leader, you're really facilitating a research process. And then finally, it can be really tricky to balance researcher goals and participant goals. And this comes up when researchers or evaluators have sort of professional or personal research agendas, if they have goals around publishing or tenure, seeking tenure. That's partly because PAR sometimes is not aligned with these sort of traditional research endeavors. And so it can be a little tricky to balance those goals with participant goals. So I'm going to ask folks to participate in the public chat in response to this question. So now that you've heard a bit about PAR, what concerns do you have about implementing it as part of your evaluation activities? And I'm going to let folks kind of type into the chat box as I go on to the next slide, just just to keep track of time. But I encourage you to type responses to this question in the public chat box, and Joe just put the question in green for folks. And I'll keep an eye on that as folks type and sort of reiterate or respond to some ideas. And you may find that more concerns come up as we go over the next slide. So I want to close today by talking about some recommendations for people who are interested in PAR. And I really have designed these recommendations in a way that is sort of focused on non-action steps. So some things you can do to kind of further explore if PAR is appropriate, if PAR makes sense, before sort of making the decision or jumping into a PAR, trying to design a PAR study. So I see one comment from Arlene about concerns about it. She says the time necessary to do it well. That is a very valid concern. As we just spoke about, it can be very time consuming, and that can be a real deterrent or a real thing to manage and consider as you go. So let's talk about some recommendations. So I think there's a lot of ways to start some sort of basic assessments, and assessing both things for you as a program director or provider, for you as an evaluator, assessing things at the level of your program, your organization. So you can start by assessing current attitudes towards participation in general. So how is your attitude, your organization's cultural attitude around engaging stakeholders, community partners, service providers? Are those opinions and experiences valued? What is the attitude towards participation in general? You can also assess if, how, and where service users are engaged in research, in evaluation, or other activities. So think sort of drilling down, not just from how do you view participation, but how do you specifically view and use service users in a participatory approach. So are they used in some ways, in few ways? Is it that sort of tokenistic involvement, or is it higher level sort of partnership involvement? And then thinking about your attitudes and cultural perspective around action and kind of quality improvement processes. So are you as an organization really open to identifying things that don't work, to pointing out weaknesses, to trying new things? How does your organization approach that general strategy of quality improvement? And the reason this sort of assessment process is really important is because if your sort of attitude and cultural approach, organizational culture around these things isn't in line with PAR principles, you can really end up doing more harm than good when trying to do a PAR study, especially when you're engaging service users and people who have traditionally had oppressive and marginalizing experiences if you are then engaging them but sort of fundamentally aren't valuing them appropriately, you may create an experience that is not rewarding and that is negative. And so really kind of orienting yourself and aligning yourself to these principles is key. You, of course, want to learn more, read more. Today's presentation is just a primer, but definitely further explore, talk to people who have done it, read the book, for example, that I cite on the end of this presentation. But also keep in mind that you want to be a real critical reader of PAR research and other resources, because the term PAR is often used mistakenly, and I have learned this from experience and doing my own research, that people often use the term participatory action research to describe things that are really more appropriately considered participatory research or more appropriately considered action research. And so you want to use sort of the principles and ideas I've presented today as kind of a bar against which to measure things that you're reading. And just keep in mind, is this really a PAR example or is this something else? And then finally, I think it's important to always start small. And this may mean simply leaving today's conference and having some internal conversations with your collaborators, with your coworkers, with your evaluator, learning more together, exploring how you use participation, considering how you might expand or build upon current participation strategies. You want to ask yourself, is PAR appropriate? Is it appropriate for what we're trying to do in our evaluation or in our other research? And as I've said a couple times today, it may be that PAR isn't the appropriate next step. It may be that you want to first think about participatory research approaches or action research approaches. PAR may not be the next thing. It may come down the road, or it may never be an appropriate approach. And then really thinking about small, manageable strategies. You want to make it manageable. You want to make it meaningful so that you feel yourself empowered as a program and as an evaluator, and you feel encouraged to continue down the sort of road of participatory action research. So making it small, making it manageable and feasible can really make it a meaningful experience. So I see a couple of comments in the chat box. I'm just going to read through those a minute here. So yes, Miguel reiterated that finding the required time to implement it well is an issue. Anka said that finding the time and resources to incorporate PAR in ongoing quality improvement initiatives and having staff who conduct evaluation in our department also have plates full of day-to-day activities and duties. So yes, all of that is really valid. And I think part of why my recommendations start sort of at that assessment and sort of internal conversations is trying to navigate some of those things. So how does PAR fit within your general strategy and things that you're already doing? So we are just about out of time, and I know that Joe has some wrap-up housekeeping to do before people pass on. So I am going to move forward to the references slide so people can see that. And Joe, I will pass this back to you.
Thank you, Amanda.
Thank you.
And thank you, everybody, for coming out today and asking questions and being so active in that chat box. Here is Amanda's contact information. I'll leave that up for just a moment.